Michael Kellett, Director, Fife Health and Social Care Partnership. Fife Health and Social Care Partnership. Strategic Plan for Fife, 2019 to 2022. The Draft. Introduction. We are committed to supporting every person in Fife to live well. I'm proud of the progress that we've made on that objective over the first 3 years of the Health and Social Care Partnership, over the 3 years of our first strategic plan, but recognise there is more to do. I'm particularly proud of the work our staff do every day in a huge variety of settings, from home to hospitals and everywhere in between, in supporting individuals who need our care and support. The work of our staff and partners working alongside individuals and communities has enabled us to reform and modernise how we deliver essential care at home to thousands of people every day. It's allowed us to make a significant progress on how we tackle the stigma of mental health and redesign our services for those with mental health challenges, so we can support them earlier and more effectively and in the community where at all possible. We've also significantly improved how we support the most vulnerable, frail individuals in Fife by coordinating all the care they receive across services so their needs and wishes are paramount. We've made progress on our Joining Up Care agenda, and we've also brought a powerful local focus to health and social care support in each of Fife's 7 localities. The Wells, a one-stop shop connecting those who need support with community assets and services where required across Fife. We are also successfully implementing the new GP contract, investing in multidisciplinary teams to support GP practices so people see the right professional the first time. We need to build on these successes and make further progress over the next 3 years. This refreshed strategic plan sets out how we will do that. In doing so, we need to be clear about the financial pressures on the FHSCP and on public services more generally. What's clear is to be sustainable, we need to do things differently. We believe when people have choice and control and are supported to live healthier lifestyles, communities will flourish. Tackling inequality is central to everything we do. Our strategy is to empower our staff and the people we serve, to capitalise on our assets, which includes our communities and partners, to build capacity and people's potential to improve their own well-being wherever possible. About the Strategic Plan for Fife, 2019 to 22. This strategic plan is for the delivery of health and social care services in Fife over the next 3 years, 2019 to 22. It is prepared by the Fife Integration Joint Board under the terms of the Public Bodies Joint Working Scotland Act 2014, the Act, and it covers all topics that are required by the Act, along with a number of other relevant topics. The Integration Joint Board is required by the Act to produce a strategic plan for the health and social care services and functions delegated to Fife Health and Social Care Partnership. The strategic plan is a strategic document that sets out the vision and future direction of health and social care services in Fife, and it includes some detail of the planned activities that will achieve this. This includes how the 9 national health and wellbeing outcomes for health and social care will be delivered locally, along with the 6 public health priorities for Scotland. Planning of activities to deliver the vision for health and social care in Fife will continue to be developed, considered and monitored on an ongoing basis through governance and local engagement structures in collaboration with partners in the independent and voluntary sectors and in local communities over the lifetime of the strategic plan. This is how the Integration Joint Board ensures the joint commissioning of services and their delivery. Locality plans. Critical to the Integration Joint Board's strategic plan, each of the 7 local areas that make up the Fife Health and Social Care Partnership develop a locality plan with partners, including patients, service users, carers and the third and independent sectors who provide health and social care support in different ways to the partnership. Working closely with our partners, the locality plans are updated on an annual basis to show how the plan is being implemented locally to ensure services respond to local priorities, needs and issues of communities. The most up-to-date locality plans are available on www.fifehealthandsocialcare.org/publications. About us. Our vision, mission and values. Our vision: to enable the people of Fife to live independent and healthier lives. Our mission: we will deliver this by working with individuals and communities using our collective resources effectively. We will transform how we provide services to ensure these are safe, timely, effective and high quality and based on achieving personal outcomes. Our values: person-focused, integrity, caring, respectful, inclusive, empowering. Our plan. Strategic priorities. We need to ensure that resources are used effectively to support Fife Health and Social Care Partnership's vision, mission and values. Priority 1. Working with local people and communities to address inequalities and improve health and wellbeing outcomes across Fife. We are committed to ensuring that people are empowered to make their own informed choices about how they will live their lives and what outcomes they want to achieve. Planning for preventative action can have a positive impact on improving health and reducing inequalities, and can reduce the demands for health and social care services. Priority 2. Promoting mental health and well-being. We are committed to ensuring that the people of Fife can get the right help at the right time, expect recovery and fully enjoy their rights, free from discrimination and stigma. The commitments of Fife's mental health strategy will require creative thinking and innovation to ensure services are fit for the future, supporting positive mental health and well-being for all. To succeed, we will require co-production across all parts of the service with communities, with our partners in the voluntary sector, with people who use our services, their families and carers. Priority 3. working with communities, partners and our workforce to effectively transform, integrate and improve our services. Delivery of effective and lasting transformation of health and social care services is central to the vision of Fife Integration Joint Board. Significant change on how services are planned and delivered with a range of stakeholders, which includes carers, patients, service users who experience services, is paramount to delivering changes. Priority 4. Living well with long-term conditions. We are committed to building on the work already started in Fife to support adults and older people with complex care needs who are accessing both primary and secondary care services most frequently. We are developing and supporting a more integrated and earlier approach, focusing support proactively with patients who would benefit from this, which includes early identification and comprehensive assessment in case coordination. Priority 5. Managing resources effectively while delivering quality outcomes. The financial position for public services continues to be challenging, and the Integration Joint Board must operate with significant budget restraints and pressures. It is therefore important that resources are targeted at the delivery of the priorities within the strategic plan.